Hi, I'm Andrea, and I'm here to talk about Florence Nightingale and the fundamental patterns of knowing for Nursing 6000 Theoretical Foundations. So, after reading the textbook Nursing Theories and Nursing Practice by Marlene Smith and the article Finding Patterns of Knowing in the Work of Florence Nightingale by Clement and Averill, I really thought one of the overarching themes of Florence Nightingale's work was optimal patient care. I saw this come to light through her dedication to leaving her family and travels to take care of other people, all of the work that she put into becoming a nurse, and how many hours she spent dedicating her life essentially to other people, and the ways she implemented new ways of doing things and by improving conditions just to overall better the patient themselves and how things were being done in healthcare at the time. In the article by Clement and Averill, Nightingale talks about nursing being more than just a hard science and medical knowledge, but that it's also about spending time with the patient and being present. That was a big thing that I saw as well. She talks about empathy in the respect to later aesthetic knowledge and how like your attitude, your mood, your interactions with the patient can really have a large impact not only on how the patient does, but also how it can impact their outcome and how significant it can be, even though it's not strictly just medically taking care of the patient. And another concept that I also found was the diverse approach to nursing. I thought this was very evident while reading the text by Smith and learning about all of Nightingale's travels around the world and how she would take factors that she implemented in one area and bring them along to the next and would continue to learn and improve them and go on from there. Three significant contributions to modern nursing. I thought Nightingale really established research into the nursing field and writing about clinical observations and examining case studies along with introducing statistics. I thought was a very important key aspect that she brought. Another one was creating standards for cleanliness, hand washing, use of lighting, and other aspects that play into taking care of the person as a whole, not only just the medical side of things, as well as creating standards that are in place to help things like infection and hand washing and things like that. And again, that nursing is more than just medical knowledge, that it's taking care of the whole person, which Marquette now uses as cura personalis. So I thought that that was a big takeaway as well. One of my personal experiences where I thought the ethical component was largely at play was I had this young boy come in to the ICU who mom found limp in his car seat, and it turns out that he had a febrile seizure. She was very concerned about this happening again, or that he had a seizure disorder. While he was with us, he was fine, but we were continuing to look on him and reassure mom that we would keep an eye on his temperature and all of his vital signs to make sure that he was okay before he went home. And she had a lot of questions about his rescue medication because that was new to them. They had never had a child with a seizure disorder. So we went through all of the paperwork. We made sure that if she had any questions, they were answered. We even pulled up a video on how to use the pen on the off chance that they would need it. We went through different ways of giving the medication with him while he was in the hospital and taking it to figure out the best way that she could give it at home. So it was really a way to work with mom and make sure that she felt comfortable, and then the kiddo also started feeling comfortable with us once the parents were comfortable with us, and it really just improved his outcome and how we were all interacting with each other. So I thought that the ethical aspect really played an important role. And then how does Nightingale's work and patterns of knowing inform the work of nurses today? I think Nightingale's work really set the foundation for nursing. I think that treating a person in a whole aspect of their needs medically, but also them being comfortable and having a clean environment. And another thing that was brought up in the text by Smith was like cleaning a person. I thought that was a very big thing because from my experience, I've noticed that people start to feel better when they're like washed up and taken care of, and they're more likely to get up and out of bed. So I think that that is also a big aspect, and it also plays into not only the ethical component, but also empirical, because they could possibly improve, having better vital signs, and then also aesthetically and ethically making them feel good, taking care of all of their needs, and really advocating for the best outcome for them. Thank you.